everyone, this is Dr. Emily Howell from Ashbridges Health Center. Today I'm going to do a video on parenting ergonomics. I know a lot of us are at home taking care of our kids usually, but especially now with COVID being self-isolated or social distancing, we're spending a lot of time with our kids, and that can put a lot of aches and pains and strains onto our bodies. Just a disclaimer as always, all these recommendations might not be right for everyone, so please check with your healthcare provider to see if they're right for you. We see a lot of patients pre and postnatally as well as all through their years of parenting. So this is a topic that's very familiar professionally as well as I'm a mom of 2 kids, so I totally get it. So a lot of the time we talk about to our pregnant patients, there's a lot of changes through pregnancy, and the majority of back pain does disappear within a few months, but there is a small part of the population that still has back pain months after pregnancy. So make sure you address that. See a pelvic floor physio, see your chiropractor, see your massage therapist, and make sure you manage that because you don't want it to keep going on and distract you from all the things you have to do with your kids every day. Another side note is the relaxin, the hormone that helps relax all our ligaments in our bodies, usually to prepare the pelvis for delivery. It also affects our arms, our knees, every ligament in the body. They usually say it lasts for about 3 to 6 months, but I found with nursing it can be up to a year. So keep that in mind, that you're not hyperextending your joints, keeping everything engaged, because your ligaments are going to be very loose that lasts after pregnancy. So the advice I give usually on a day-to-day basis is how to care for your baby. I borrowed this from my daughter. Usually carrying. So we always have a side that we prefer. I really like my left side because I am right-handed, so I could do everything with my right, but all of a sudden when I had kids, I had a history of right-sided back pain. That went away. It moved to my left from doing this. So the little hip hike, it helps to hold the baby on the hip while you can do everything else, but it ends up shortening everything through here quite badly, and it can make some major problems, as well as you end up putting more of your weight on the left side, that kind of thing. Ideally, if you can, get your baby in front, or toddler, so that you can dispel the weight or take turns. I could never hold my kids on my left side, so I did find wearing a carrier through the day at home, or what I refer to as the hippie chick hip seat. I don't have a photo of it, but basically it's a nice wrap that has Velcro as well as a clip, and it comes out with a little ledge. So instead of having to do this to hold your baby, you can actually stand up straight and it doesn't torsion your spine and shorten all the muscles. The other thing always is to make sure you engage your pelvic floor and your deep abs every time you're having to pick up your child, and bend at the hips as opposed to bending over. After about 45 degrees, your muscles go silent and you're hanging on your ligaments. That's the weakest part of your back with the worst blood supply and is the slowest to heal. So if you can really either bend at the hips and use that hip hinge, or get down at their level and talk to them, even sit on the floor and hug them this way, as opposed to coming up, with a squat, as opposed to this. That also applies when you're taking baby out of a crib or a toddler. When a lot of parents I end up seeing doing this. And what you can try to do is get your hips as close to the crib as possible, and then, or you can take yourself to the corner and do a bit of a squat and lift them, or pull baby to sit, and then they're a little bit taller, and then you can pull them up. Those are just some suggestions to help prevent back pain. That also applies to a car seat, any sort of awkward position. If you can have yourself facing the baby as opposed to in a twisted position, that will affect your back. Oh, I felt that right there. Stroller height, similar to a ergonomic setup for your desk, which I have another video on. You want to basically have the stroller height so your elbows are at 90. My husband's a lot taller than I was, so we actually had to buy a stroller where the actual bar was adjustable, because he's 6'3", I'm 5'8", so we needed something that was comfortable for both of us. You want to be able to push at a comfortable position without having to go too far here, or shoulders up, or bending down. I see a lot of those folding strollers, and I actually had to get one that was a little bit higher because I'm a bit taller than the average woman. So keep an eye on that, because you're going to be using that every day, especially to get out of the house the limited times we can. Really important for your ergonomics and your long-term wellness. The other thing too is when you're pushing, I had mommy thumb with my first daughter. So what you want to actually do is try to put your thumb on top of the bar as opposed to underneath, because 5 fingers are stronger than 4 against 1. So if you've got a sore thumb or forearm, and try not to have the grip of death, try to have something that's relatively easy that you can keep a grip on but doesn't hurt your forearms and elbows. And also keeping your wrist in neutral so you're not here or here, that will help as well. You want from your elbows to your fingers as straight as possible because that's a much stronger unit than your poor little wrist. What else? Feeding and sitting postures, same idea, where you want to be facing the baby. Try to bring the baby up to you if you're nursing rather than bringing yourself down to baby. Use some pillows, use some props. Anything you can do to support your spine so you're not in a hunched over awful position. I know those nighttime feedings when you haven't slept for months, it's really challenging, but if the more ergonomic you can be, the less you'll suffer and the more comfortable you'll be, and you'll be a better parent. Last but not least, carriers. This is a question I get a lot. I used an Ergo Baby because 10, almost 11 years ago when I had my first kiddo, that was sort of the only one that was able to have most of the weight on the hips. I see a lot of people putting their Ergo Baby strap here. That's not where you want to go because that's where you're going to put it. You actually want to put the weight in your hips because your legs are your strongest element. So make sure the strap fits around your hips. There are extenders if people need them, so definitely worth a purchase. And make sure you have something with thick padded straps as well as a clip either in the front or the back depending on where you're wearing baby, so you're not having to hunch and hold it worried about it slipping off your shoulders. There's also Moby wraps, that kind of thing. I found they were pretty good, but I did find they bunched up in my traps and would give me shoulder pain, so make sure you're having a nice broad approach. I found after my kids got over about 15 pounds, I did need something with more structure. Some people also really like a Baby Bjorn. I found it made my mid-back burn because there was no weight on the hips. It was all on my upper back and neck, and as a nursing mom with a tiny baby, it was just too much strain on there. So there's some great sites that you can look at options, and there's some great carrier professionals. So if you need a recommendation, please feel free to email, text, call, message me. I can pass you on to them. One in particular that comes to mind is Allie Dennis from Little Zen One. She's like the carrier guru. So she'll be able to talk you through some options, what might fit you best. Also, considering your partner, you want to get a carrier that's comfortable for each of you, or get 2 separate carriers if you have the finances to do that. Finally, just make sure you're engaging your pelvic floor and your deep abs. After pregnancy, all of us have rectus diastasis, and that's a separation of the abdominals. I'm going to do a separate video on that. I'm just looking for a photo, but what happens is this is before pregnancy and that is after. We do have a separation to make room for baby. Some professionals are actually thinking we end up with rectus diastasis to prevent pelvic floor prolapse. That's a whole other conversation. I do have a video on core breath, so feel free to look at that. But the key is that wearing a carrier can make rectus diastasis worse. So make sure you get checked for that and how to cue yourself so that you're not opening up that more. I made that mistake after my first child and then learned about it after my second. So please don't do what I did. So I hope that helps you get through these challenging days at home with our kids. Make sure if you have any questions, feel free to contact me. I'm available for on the phone or video chats, absolutely. And thanks for watching. Please feel free to share with friends and take good care of yourselves and be well.